Hi, and welcome to your Chapter 2 of your textbook, titled Workplace Safety and Wellness of the EMT. We'll get started in our next slide. All right, if you learn anything in this chapter, it should be this one thing that the EMT safety is always the first priority on every single call. You can't help somebody else if you, in turn, are hurt or injured. So please, always make sure that you, your partners, and your patient is safe at all times. As EMTs, sometimes we have to deal with emotions on scene. Take a minute and go ahead and think about whose emotions you might have to deal with and what emotions those might be. Hopefully, you've got some time to go ahead and think through that. So, whose emotions might we have to deal with? Well, the list is long. Sometimes it's the patient, sometimes it's the family members, sometimes it's bystanders and you don't even know who they are, or the patient doesn't even know them. Or you know what? Sometimes it's your partner's emotions, and lastly, yeah, it could even be your own emotions, and sometimes they could get in your way while you're trying to treat and help other people. A psychiatrist came up with the 5 stages of grief, and these are emotions that deal with death or dying. The 5 stages of grief are depression, anger, denial, bargaining, and acceptance. And they say if a patient receives either bad news or maybe a family member receives bad news, that as they grieve, they go through these 5 different emotions. Maybe it's depression, or anger, or denial, or maybe it's bargaining and acceptance. The psychiatrist said that not every patient experiences all 5 emotions, and sometimes they don't experience all 5 emotions in order. Sometimes they spend longer times at or at different emotions. But if you're treating a patient or if you're treating a family member, right, you can go ahead and take the time to realize that maybe that patient or maybe that family member is experiencing one of these 5 stages of grief, as either they themselves or their loved one are going through a very difficult or trying time. Some ways we can deal with death and emotion of a dying patient is number one, maintain the patient's dignity. Maybe this is referring to the patient, maybe using their name or a title of respect when you're talking to the family members or loved ones. Showing respect to the patient, maybe even covering them up with a sheet if it's appropriate per the police officers. Communicate with the family members, let them know what's happening. Don't give them false hope if there's not really any chance that that patient's not going to make it or has not made it. Allow the family to express themselves. There's cultures and people all over the world that are different. Allow them to express themselves. Sometimes this might be through touching the patient or crying over the patient. Maybe some of them are going to be frustrated or angry, and sometimes maybe people will want to pray over the patient. That's okay. The best thing you can do as an EMT in this situation when dealing with family members is to listen. You don't need to give them a secret answer of success or a way to get over their grief. Sometimes it's best to just listen to the family members. Well, if you were hoping to deal with a stress free career, I'm sorry, you picked the wrong field. As an EMT, we deal with a bunch of different types of stress. You can click through the next couple slides to see what type of stress that we deal with as EMTs. Physiologically, there's 3 different types of stress reactions that you as an EMT need to be familiar with. The first one is an acute stress reaction. You've probably had this before. Anytime you've been nervous, maybe before talking in front of a group or giving a presentation, or maybe a couple minutes before a big game, where you've got the butterflies in your stomach, your heart rate's racing a little bit, you're maybe perspiring a little bit. This is an acute stress reaction. These are normal responses to stress when your body is stressed out. A delayed stress reaction would be dealing with stress after the event is over. Sometimes this can also be PTSD or post traumatic stress disorder. These patients will have all of those same feelings as an acute stress reactions, but it will be delayed later on and after the event. And then lastly, our last type is cumulative stress reactions, and this is better referred to as burnout. This might be stress over and over and over and over again, and you just get tired and worn out and burnt out of maybe the same calls or the same patients or the same things over and over again. These are three different stress reactions you can experience as an EMT and ones that you should be familiar with. Because as an EMT that we deal with stress, I encourage you to take the next 5 or 10 minutes to think of ways that you can correctly manage your stress. If you're looking for ideas, go ahead and flip to page 23 of your textbook and look through some ideas that your book has listed for you. A couple professional stress management sources that we have in the field are critical incident stress diffusing and critical incident stress debriefing. Sometimes this is referred to as critical incident stress management. These are actual techniques that are used in the field professionally, sometimes with actual mental health professionals, or with chaplains, or with other people that can help us, EMTs, paramedics, and other people to deal with stress of a very stressful or critical event. Go ahead and look through the next couple slides and look for more information on page 25 of your textbook. Another important topic as an EMT is protecting yourself from disease. This is very important. As an EMT, you're going to be exposed to all sorts of different patients with different diseases. Maybe some are going to have tuberculosis or meningitis or even pneumonia, and you're going to be exposed to some of these different pathogens. Well, go ahead and take a look through the next couple slides to learn more about different pathogens, whether it be bacteria, virus, fungi, protozoas, or even helminths, which are like parasitic worms. A communicable disease is a term you need to be familiar with. This is a disease that can be spread from person to person. There's two ways that this can happen, either through direct contact, of maybe somebody sneezing or coughing directly into your face, or maybe indirect contact. Let's say that person sneezes on their hand or coughs on their hand and then puts it on a door handle, and then you, as being the next person, come up and touch that door handle. That would be an example of indirect contact. Either way, you need to be able to protect yourself from diseases. An important term for you to know is standard precautions. Standard precautions definition is the process of protecting yourself from communicable disease transmission from contact with blood or body fluids. Now, there's a lot of ways that we do this. Maybe we wear PPE or personal protective equipment, or maybe we are washing our hands or getting our vaccinations. Regardless of how we're doing it, standard precautions is the process of protecting yourself. So all those other things fall under the category of standard precautions. Standard precautions would be the umbrella term for the vaccinations as well as the PPE and the other ways that we protect ourselves from communicable disease. An important term for you to know is standard precautions. Standard precautions definition is the process of protecting yourself from communicable disease transmission from contact with blood or body fluids. Now, there's a lot of ways that we do this. Maybe we wear PPE or personal protective equipment, or maybe we are washing our hands or getting our vaccinations. Regardless of how we're doing it, standard precautions is the process of protecting yourself. So all those other things fall under the category of standard precautions. Standard precautions would be the umbrella term for the vaccinations as well as the PPE and the other ways that we protect ourselves from communicable disease. PPE, or personal protective equipment, is the way that we practice standard precautions in the field. Go ahead and click through the next couple slides to look at the different equipment that we use as EMTs to protect ourselves from communicable disease. Also, go ahead and flip to page 29 of your textbook to look at some of the other different equipment that we have. Also, familiarize yourself with the different types of masks that we have to help protect ourselves from diseases. Cleaning is another way that we protect ourselves from communicable diseases. Now, we have different types of cleaning. We have cleaning, disinfecting, and sterilization. Now, if we have our patient riding in the back of our ambulance, right, we need to clean the back of the ambulance to get ready for the next patient and then to get rid of all of their diseases or bacteria. Now, we must clean anything that the patient did not touch. Maybe that's the bench seat of the ambulance, or maybe the bag or other equipment that you did not use. Anything that actually touched the patient, maybe the stretcher or your stethoscope, needs to be disinfected. Maybe with a germicidal solution or a bleach solution or even some disinfectant wipes. That equipment needs to be wiped down. Any equipment that comes into contact with the patient's blood or body fluids needs to be sterilized. The only way to sterilize equipment is to send it off into an autoclave, which heats up the equipment to a certain temperature for a certain length of time to absolutely get rid of every last remaining bacteria molecule. Now, we don't have the opportunity to do this as an EMT because we don't carry an autoclave on our ambulance. So a lot of the equipment we use nowadays is actually disposable. We can throw it away when we're done with it. After it's touched the patient's blood or body fluids. But remember, we should throw it away in the appropriate containers. It's important as an EMT to make sure that you have your immunizations and that you keep up to date on your immunizations. These immunizations will help protect you from diseases. You can see a list of the different immunizations that you have listed here on this slide. You can find more information about them on page 31 of your textbook, and please make sure you keep up to date with your immunizations. It's your responsibility. As an EMT, we are likely to get exposed to blood or body fluids. This might happen through maybe getting stuck with a needle, or maybe getting blood in your eye or in another wound that you have, right? These are contact precautions. These are things that are important, and you are now at a higher risk of transmitting or transferring a communicable disease. If this is the situation, you need to immediately notify your supervisor of the date and time and details of the exposure. First, make sure you finish your call, clean the area with soap and water, and notify your supervisor. Listed here are a couple different diseases that are concerning to the EMT. These are highly transmissible diseases and ones that you could get from getting exposed to blood or body fluids or even getting stuck by a needle. Take your time to familiarize yourselves with these different diseases by clicking through the next couple slides. You can also find more information on these diseases in your textbook starting at page 31. As an EMT, you're likely to encounter a lot more threats than another job. What are some of those threats that we might have at work as an EMT, and how can we protect ourselves? Go ahead and click through the next couple slides to find different threats to us at work and different ways that we can protect ourselves. You can also find more information on these in your textbook from page 37 to page 39.